welcome to Meeting Midway, Tier 2 Prevention, hosted by the Missouri Department of Mental Health. My name is Carl Hanger, and I will be your chaperone as we walk together through Tier 2 supports. What is it? How does it work? What does it use, and how do we use it? Together, we'll do a deep dive with each episode into this topic to gain greater knowledge about this subject. At the end of each episode, it's hoped that you'll have a greater understanding about Tier 2 supports and see how it relates to your daily lives. And with that, let's move on to the show. Hey everyone, and welcome to another episode of Meeting Midway. On this episode, we're talking with Nicole Jones from the Missouri Department of Mental Health. Nicole and I will be going over what's known as the TSSET, T-S-S-E-T. This stands for the Targeted System of Support Evaluation Tool. This tool is actually very unique and is used by the Tier 2 team within DMH. The tool itself is essentially a pulse check within the provider to assess their Tier 2 and Tier 3 capabilities. Through our discussion, Nicole and I review what this tool is and how it can benefit providers in not only currently, but in terms of long-term longevity for their organization. And with that, I hope that you're able to sit back, relax, and enjoy the show. Hey everyone, and welcome to the show. We have Nicole Jones with us on the show. Nicole, do you want to introduce yourself to the audience, please?
Hi, yes. My name is Nicole Jones. I'm the Director of Risk Prevention at the Missouri Department of Mental Health, Division of Developmental Disabilities. I lead the initiatives for the division related to building capacity of service providers and enhancing state systems to detect and mitigate risk for populations with complex needs. Specifically, I help lead the team, the risk prevention team, which provides consultation, training, and package supports that focus on targeted strategies to address common problems within a population who just need a little bit more support beyond universal best practices. I have about 13 years of experience in the field of human services. I started my career helping families and older youth in Missouri's foster care system who had suffered abuse and neglect. And within the last 7 years, I've been working on capacity building efforts for the division regarding public health model and implementation of evidence-based strategies.
All right, excellent. So on today's show, we're actually talking about, I don't know if this is a new tool or really, but we want to get the information out, but we're going to be talking about what's known as the TSSET, T-S-S-E-T. So can you just describe for the audience what this tool is so we have a good foundation?
Sure. So the TSSET stands for Targeted System Support Evaluation Tool. And what it does, it just measures the implementation status of programs for people being supported by an organization. So specifically, it looks at identifying the strengths and capacity of an organization, as well as those gaps in support. And so the TSSET will assess whether an organization has systems of support that provide both targeted and intensive interventions when a person's needs require that level of support, and that their systems promote good treatment integrity and maintenance of that kind of support over time. And when I say treatment integrity, I mean that we're implementing supports as they are intended to be implemented, so we're doing them like we're supposed to. And regarding maintenance, it just means that we are able to sustain that kind of support over a period of time, despite if we have people leave or we have a change in resources. So it's built to last as a system of support. And so I know I used some strange words in there with targeted or intensive, and what does that even mean? But I think to provide some context, it might be helpful just to talk about what the public health model is that Tiered Supports uses. So this public health model was developed by the Center for Disease Control, and it uses a continuum of support to manage the health of an entire population of people, right? Ideally, in a healthy population, only 5% of that population would need really intensive systems or supports, and we'll talk a little bit more about what that is. 10 to 15% of the population would need Tier 2 supports, and again, we'll talk a little bit specifically about that in a minute. And then the rest of your population, so 80 to 85% of your population, would only need some Tier 1 universal supports. Now, currently, Missouri's waivered population does not meet that distribution. We do not have a very healthy population. Just looking at individuals who receive residential services within Missouri, about 56% of our population demonstrate risk criteria that places them either as really high risk or at risk for poor outcomes, while only 43% of our population have no indicated risk. We have an infographic that outlines what those risk indicators are for the division, and we can include that in your show notes, but it's data points like the number of psychotropics a person's prescribed, how many reportable behavioral events have happened within a span of time, whether they've been hospitalized or had some sort of law enforcement contact. So it's different risk indicators like that that the division's looking at to identify people who are high risk or at risk. And so we've talked a little bit about like, oh, tier 1 or tier 2 or tier 3, and that it's a continuum of support. So what does that really mean and what does that look like? So tier 1 builds universal systems of support, which are implementation of strategies that everyone needs to have a good life. So we're thinking Maslow's hierarchy of needs, right? Safe place to live, healthy and positive relationships, access to healthcare, meaningful choice, meaningful activities in their day, using person-centered strategies. All those are tier 1 supports. And tier 1 supports should be happening always. We should always have those things. And whenever we have a lack of those universal supports, we tend to see poor outcomes happen pretty quickly. But tier 2 and tier 3 are not always and forever supports. They're only layered on top of tier 1 if tier 1 supports are not enough to meet that person's needs. So if they have some additional needs beyond those universals, you could layer in tier 2. And at the tier 2 level, we're looking at targeted systems of support. So I've used that word before, but it's focusing on being able to identify when people are showing risk and having an implementation process to address that risk before we're bubbling up into actual crisis. So interventions in tier 2 are targeted for those at-risk individuals. They're meant to be very easy, packaged off the shelf. They're matched to that person's needs. They're faded out when they're no longer needed, and the person is able to self-manage. You don't need specialized degrees or knowledge to implement these supports. It's things like skill building. It might be addressing common problems. It might be changing parts of the environment. But again, very simple plan to address common problems, common issues to help support the person. Tier 3 builds those intensive systems of support, which focus on implementing integrated clinical treatment. So this support is the most intensive, it's the most individualized, and the most expensive because it involves clinical professionals often, like BCBAs, psychiatrists, licensed professional counselors, who are implementing clinical treatment plans. And again, those treatment plans will be faded out once the person no longer needs that level of support. So it's a full continuum of support where everyone always gets tier 1 all the time, no matter what, because that's just what everybody needs to have a good life. But tier 2 and tier 3 can be layered on top of it as the person's level of need increases.
Excellent. So, and I'm glad you're going to share some information about the risk indicators in our show notes so that we can get that out there to the audience. And I just want to remind the audience that we do have an episode, I think it's episode 14, where we talked about risk screening. And I think that's a little bit of a different topic than what we're going to be talking about now. But if you are interested in terms of trying to develop a risk screener and things of that nature, please go back to that episode there. But let's just move on to how does the TSET work? Because I know it involves a lot of different approaches to get a very holistic picture of what's going on with an organization.
Yes, our team, first we would meet with an organization to discuss what they're hoping to accomplish by working with tier 2. So that way we get a good idea of what their goals are and what their expectations are. Then we'll talk about what we can provide at tier 2 and how we can assess those gaps and strengths of an organization, which we use our TSET for to assess that agency-wide implementation. And so the TSET is composed of really 3 main phases. The first phase is kind of a discovery phase where we're gathering information from the organization. Information necessary to kind of score the TSET is gathered through lots of different sources, which can include review of permanent products, such as data sheets, meeting minutes, the agency's policies and procedures. Might also be observations of support and staff. It include administrative and staff interviews and surveys. So all that information is kind of gathered during that discovery phase to try and see where the strengths and gaps are. Once all that's gathered, we move to that assessment phase. And this is where we will score the TSET based on that information we've gathered from the organization. And we'll compile our findings into a report that outlines both the strengths and gaps for the organization. And then the final phase is our recommendations, a kind of contracting phase where we'll share with the organization the results from the TSET and then provide our recommendations to address any gaps that were identified. Then we'll collaborate with the organization to decide what recommendations they would like to move forward with, and then together develop an organization action plan that will outline the new goals and tasks to implement targeted systems of support.
Okay, so I'm just trying to put this another way. So the TSET is kind of a medical check of an organization to see how well it's functioning and running. For example, if we go to the doctor, they do various tests, and if they ID that, like me, you might be a little bit overweight, you might need to lose a few pounds. So here's a diet and exercise program to kind of do and to stay healthy. I mean, that in my mind, when you were describing it, that's kind of where my mind went, just kind of a check to see where the provider is, or I'm sorry, the organization is, and addressing it to make them aware, one. But then I think the next step, of course, is to work with them to strengthen the areas where they're a little bit weak. I mean, am I in the right ball field there?
Yeah, that's very much what it is. It's, we're looking for proof or evidence that they have these kinds of systems already in-house within the agency. And we're looking, do those systems of support meet best practices? Are they doing things that we would consider part of this public health model and providing that continuum support using science from implementation science, behavioral science, right? So we're looking at all those things and then identifying, hey, we got some areas here where we're not so strong. And what do we do next?
And in reality, this is beneficial to the organization because it will strengthen their overall, well, to get into a business side, business model so that they can address situations before they become an emergency. In other words, basically, making them have a more robust staff population, training procedures, making sure things are drafted. So, because we are in phase right now where people are leaving employment, and if one person does everything, if that person leaves, then everyone's kind of going to go, what do we do if nothing's written down? And I think there's something in one of the podcasts where we mentioned what a system is. It has to be written, alive, and sustainable, or something along those lines. Is that right?
Yeah. So when you're building systems of support, you ideally want it to be written, meaning you have a policy or procedure that outlines exactly what's supposed to happen. Because, like you said, if only one person is making something happen and then that one person leaves, then it's unlikely that other people are going to be able to make it happen because they probably may not know exactly what to do or may not even know that that was something the person was doing, right? So putting it in a policy and procedure ensures longevity. Two, alive is meaning, okay, so we have a procedure, but are we actually doing the procedure? Are we actually following the practice and not just having this procedure in a dusty binder somewhere that we know we have it, but we don't really follow it? So it's also making sure people know what to do and are doing the thing that we said we were going to do in that policy and procedure. And then that sustainability part is, again, planning for longevity, because what happens if you do have turnover? What happens if you lose some resources? Maybe budget's tight or technology that you rely on is breaking, or there's a new directive that comes out that changes things. Like, so what do you do in that instance? And so having some backup plans of, if this happens, this is what we would do to sustain that system over time. So trying to plan around those kind of barriers that could happen.
So now I know, I guess, the grandfather or father or parent of the TSET is the asset. Can you describe how those two are related to each other? Because I know the asset is used heavily in Tier 1. So if you can just kind of just go into that just a little bit, please.
Yeah, so Tier 1 also uses an assessment tool called the ASSET, or the Agency Systems of Support Evaluation Tool. And this tool was created by adapting the SET, which is a school-wide evaluation tool for specifically our human service settings and the needs that we have for our population. So at the time, Missouri's Department of Education had already been implementing this kind of public health model within schools in Missouri. So we looked at kind of what they were doing and seeing how they were addressing capacity, and felt like, oh, this is something we could bring to our setting and help people kind of enhance what they have and ensure better outcomes for Missouri's population. So that's kind of how the asset came to be. And so the TSET is very similar to the asset, but it's focusing on looking at those Tier 2 targeted and Tier 3 intensive supports when they're evaluating and looking at things, whereas Tier 1's really looking at those universal best practices and making sure those are happening. So the TSET looks at organizations' commitment to doing PBIS implementation. So are they doing good tier one? Do they have an agency team? Is their administrator involved? Do they have practices around team-based planning? So do they have an implementation team that helps monitor progress and things like that? They look at data analysis and risk identification. So how do you know someone might need targeted or intensive supports? As well as what do you do as far as intervention and support matching to make sure, okay, we have someone at risk, but what do we do about it? And then progress monitoring of those kinds of supports. So how do we know it's working? How do we know we have good treatment fidelity? How do we know that we can fade out? Like we don't need the support anymore. And then again, like the implementation strategies and practices themselves. So that's kind of what the TSET's looking at whenever we're assessing an organization system of support.
And we may have danced around this just a little bit, but it sounds like the TSET is very beneficial for an organization and provider. But can we just kind of, in this question, just really bring home what are the benefits of using the TSET and how can it help a provider, basically?
Yeah, so the TSET will help identify those gaps, again, related to monitoring the health of the whole population and whether supports that we have are adequate to help individuals who have complex needs. And it provides really clear implementation practices to help sustain those supports for individuals with complex needs. And so using that tool can help you increase provider capacity to support on a full continuum. So full continuum of support that you can layer on as a person's need increases to help improve, those quality of life outcomes. And I think it's important to realize it follows the process of, okay, first we're just defining what the problem is, right? What is the gap? Figure out why it's happening, or maybe it could be because we don't have anything in place. Maybe it's because there's a training issue. Like where's the problem happening at and why? Then developing that solution and then coaching people on what to do about it and then monitoring to see if it's working, right? And so you're just following that kind of cycle of define the problem, figure out why it's happening, figure out what to do, and then coach people on it, and then evaluate if it's working. And that's what you're going to do with the TSET. It's a similar process. You'll start with your baseline, you'll start implementing. Typically, we would suggest within a year, we would reassess to see where we've made progress and continue that kind of process until we've hit high implementation.
Okay, and just thinking this through our discussion and just what was just said, basically it benefits in that providers and organizations are able to address situations as they come up, yes, but also on the individual side for the individuals receiving services, it's not going to necessarily disrupt their services to where they, in some circumstances, have to move to a completely brand new home or prevent hypothetically hospitalizations or crisis stays at certain locations. That's going to limit that possibility if the TSET is used and if the provider is actively working on addressing the barriers and trying to strengthen their overall system. Am I in the right thought there?
100%. So the TSET itself is really just an identification tool. It's that implementation afterwards that really kind of makes the difference, right? So we know where we're failing, where we're having these gaps, and so what can we do to address them so we can support people with complex needs, and we don't have to have a situation where I have to give a 30-day notice, or we're ending up in a hospital, or we're having these really poor outcomes happening for our individuals because we just don't have the capacity to support them well. So this tool will help identify where are we not meeting those needs and how can we build upon them. So when we do have someone come into our agency that has complex needs and needs additional types of support, we're well equipped to be able to provide that.
This leads into our next question. So once the TSET has been used and gaps have been identified and things of that nature, what would be the next steps for a provider or an organization beyond that?
So we've talked a little bit about this when we were kind of discussing the phases of the TSET, but after providing those recommendations and doing that contracting phase where we decide what the goal should be and where we're going to move forward, we would start implementation. And at this phase, we're actively meeting with the organization and using the organization's action plan to help guide those implementation efforts. And this can include a range of things, right? It might be we're training staff. It might be that we're building policies and procedures. We might be improving on data and coaching systems. we might be developing a way to screen that supported population for risk and be able to do something about it. So we're really focused on system-wide building that includes, like we talked about, that written, that alive, that sustainable components. So that way we have systems that support putting in tier 2 interventions like check in, check out, or safety crisis plans, or enriched environment, or any of those kinds of skill building interventions that we're hoping to use.
My next to last question is, you did mention that Missouri is currently using the TSET and the ASSET, but is the TSET being used anywhere else? Just so that we have a much clearer picture of maybe other locations that are using this tool.
So right now, Missouri is the only one using the TSET, as we're the ones that created it. And I don't believe anywhere else has it taken it. We've worked with the May Institute, and they've looked at our TSET, and I think they're working on trying to develop a tool that fits their state and their standards. But school-wide have a thing called a tiered fidelity inventory for tier 2 that they use to assess implementation at the tier 2. And I can include links to that. PBIS.org does provide a lot of tools and assessments around tier 2 implementation. So I can share those kinds of things. But again, those are for school settings. It's not adapted to our human service settings or long-term care. And I'm not aware of like any other type of tier 2 tool that has been created for human service settings that looks at that implementation at the tier 2 level. We do have other states that are implementing positive behavior supports within human services and with this population particularly, but many don't have that established tier 2 practices at a statewide level. So example, Minnesota is doing a lot of work and have resources available that I could probably share in the show notes as well. They have training modules on HCBS or settings for HCBS. They do a lot of work around person-centered strategies and have done a lot on personal advocates. And I think that that's a lot of resources there that are helpful. But as far as tier 2 goes, I think we're probably one of the leading edge of that across the United States. And so it's exciting to kind of do and kind of lead the way. And I hope we can continue to collaborate with other states like we've had the opportunity to do to date. So.
Yeah, and I think a lot of collaboration goes on through the Association of Positive Behavioral Supports through I don't know if it's a subcommittee or a group, but the IDD group within that organization that also has other areas, for example, family, that there's a family group and a few other locations in there. So yeah, I think that's really important to put out there that there are connections being made across the continental U.S. We, of course, are making connections internationally because this is also being used in Australia and things of that nature. We'll actually have a podcast probably later this summer on that. So yeah, I just want to review the resources that you mentioned that we'll be sharing in the show notes. Nicole, you mentioned that PBIS.org assessments will be there. The TSET, the risk criteria that we use here at DMH in Missouri, some information from the May Institute and the Minnesota PBS link as well. But yeah, are there any other show notes or anything that you can think of off the top of your head? I think we have like a tier 2 page or something like that may be of interest to people.
We can share our tier 2 page for the division. It talks a little bit about what our team does. I also think I can share information for the Association for Positive Behavior Supports, which is an international association. And you're right, we do have a subcommittee for IDD population. So I could share information on that. We've actually, that group has written a couple of briefs, white paper briefs around practices and PBIS. And so I could probably share those as well if people are interested in kind of learning more on that subject. But it is exciting to see this work being done and being brought to the human service settings because I think it's been needed for a long time.
All right. And with that, Nicole, I want to thank you for being a guest on our show, and I hope you have a good day.
All right. Thank you so much for having me.
Hey everyone, this concludes our show. Thank you for stopping by to learn more about Tier 2 supports and taking a deep dive into this topic with me. If you enjoyed the show, learned something, or perhaps feeling generous, please feel free to hit the like and subscribe feature to receive additional information on shows as they come out in the near future. And with that, please remember to be hopeful, bold, and adventurous in all that you do. Take care everyone. Bye.